Welcome to George, SGUL's online curriculum app. George is designed so that you can access curriculum information easily when you are on the wards with students, so you know what to teach them and how to supervise the clinical learning. The best browser to use George in is Google Chrome. If you have an SGUL email, enter this to log on, as it gives you greater functionality. If not, we prefer if you use your NHS email to log in, but any email address can be used. Before we go into the map, let's briefly look at the dashboard here. Some of these optional functions are more student-facing, but those particularly useful for you will be to access the guide, to contact the curriculum team here, and to update your profile details here. While here, you can switch to dark mode if that improves accessibility for you. Browsing the map. There is currently only one academic year, 2022 to 2023, but these will be added year on year. Select the year that your student group is in. Most of the time, your students will be in TP or F year, but occasionally you will see students in M5 Year 1 and 2 on the early years clinical attachment. We will now focus on TP and F clinical attachments. Select P year and you will see all the placements that the students do. Integrated medical specialties and general surgery and surgical specialties are further subdivided into subspecialties. For example, in surgery, we have general principles, which contain all the pre, peri, and post-operative learning outcomes and conditions relevant to all surgical specialties and subspecialty areas like breast or urology. Underneath this, you will see all of the teaching and learning guidance for that area. You will always see learning outcomes and core conditions, and may also see other guidance, such as lists of presentations, investigations, procedures, and top 100 drugs. Let's now walk through this guidance. The clinical curriculum. All students have a list of conditions to guide their clinical knowledge acquisition. This is known as the core condition list. They also have clinical skills and clinical behavior learning outcomes known as clinical practice outcomes. To understand this better, please see the clinical curriculum leaflet we have sent you. Let's click on core conditions for urology. You will see that there are 17 conditions in urology that they need to know about, grouped into 5 categories. Open a condition in Note to see more detail. The essential information at the top is the CSP rating, which tells the student whether they need to learn about the condition comprehensively, to a standard level, or just the principles. There are definitions for these ratings elsewhere in the map. Students have the ability to make their notes here next to the learning guidance. Moving on to learning outcomes, these are the clinical skills and behavior outcomes which can be in any of the 15 areas outlined on the leaflet. There are 11 outcomes that the students have to achieve by the end of the placement. The outcomes may refer to more lists, such as a list of presentations that they need to formulate differential diagnosis for, procedures they must see, or drugs used in urology. Any lists referred to will also be here. How to use this map during teaching. Students are keen to clerk, present, and have bedside teaching on patients relevant to the topics from their core condition and core presentation lists, and to discuss and ask questions relevant to their learning outcomes. Many of them need guidance on how to structure their time and use the clinical environment in the most optimal way. Please use this map to help you help them, our future colleagues, and perhaps our own doctors.